it changes how you feel about a vaccine. So it was actually one of the big points in the election. So anyway, there's vaccination coverage. Some have just a single dose of the vaccine. And in 2007, 25% of the girls in America had a single shot. In 2011, 53% had it. And these were girls aged 13 to 17. And that number hasn't changed at all. It went from 53 to 53.8 with a single dose. And only 33% received all 3 shots.
Okay.
So it's kind of a heads up that there's a way that you can protect yourself if you're listening, you're a young girl, or your daughter if you're a parent, or your granddaughter. And the same guidance was issued actually for boys in 2011. So at first it was got to be like a girls' issue, and then people recognized human papilloma virus relationship to cancer in males.
Yeah.
And so boys were encouraged to have it. There's 14 million Americans who become affected each year. And as I said, it's related to cervix, vaginal, vulvar, penile, anal, and oropharyngeal cancers. And parents say, well, the vaccine wasn't needed, there's no knowledge, or the girl's not sexually active, or the safety concerns. And most of these are not real reasons. They're not valid reasons. They're reasons that people make up.
Yeah. It's really a shame when, someone gets cancer and it was preventable.
Well, and think about these people. There's a whole epidemic now among children of parents who refuse to give the children a vaccine.
Yeah, it's really sad.
And there's all kinds of stories out there. The vaccine causes autism, which is not true.
Not true at all.
Which is not true at all, but there's a story circulating. And so when you have a chance to prevent 30 or 40,000 cancers, it really gives you a heads up that for your own child, for your child's future, and for your child's loved ones, you should really think about getting that vaccine, pushing that vaccine, and talking to your doctor about it. And if you have concerns, read about it. But read scientific literature. Read literature that has validity, not literature that is just hearsay. So really, we can save lives with vaccines, and you can save cancers, so prevent cancers, by getting the human papilloma virus vaccine for your children. We have a caller on the line is Dr. Eisen, who works with me. Dr. Eisen is a Argentinian-born and educated physician. He trained at Columbia Medical School in radiation oncology, and he's devoting his life to Spanish-speaking patients with cancer. And obviously, there's a lot in New York City, and unfortunately, a lot of these people didn't have access to getting care with their doctor in fluent Spanish. So he came up with this idea that he could take care of the Spanish patient in Spanish, communicate better, and not have to go to third parties and ask the nurse, what is he talking about? And he's available day and night, and I'll give a cell phone. Buenos dias, Dr. Eisen.
Buenos dias, Dr. Lederman. How are you?
Did everything I say, was that all true?
Yes, absolutely. One other thing that I noticed is that some of the patients that I see recently, for example, I just saw a patient with sarcoma. Many times during the interview, we are able to find not only new things, but all things that we can review it and find a new way to attack the situation. So it's extremely important, as you said, the language. I really find out after 30 years working in New York City that the working in your own language, it makes a huge difference to find a way. And this patient actually were able to help her. And in fact, now there are new situations. We are doing new X-rays and scans, and able to manage the situation, particularly in this patient with sarcoma.
But you just showed me. You just showed me the other day. You had a patient with 2 cancers in the liver, and you treated the 2 cancers with radiosurgery, which is a non-invasive method of treatment. And what happened to those 2 cancers in that patient in the liver?
Well, I mean, I would say that not to my surprise at this point, but essentially a patient went for a PET-CT, which is a study that shows us that if there is an issue, if it's still there's activity on the tumor, and actually it's nothing. I mean, it's completely under control.
So wait a second. So you treated the 2 cancers with radiosurgery. Each one had 5 treatments, and then they had a follow-up PET scan, and the PET scan showed what exactly?
Well, it shows that there is no activity at all. I mean, there is
So the cancer went away?
It went away.
And that was with what, 5 treatments?
5 treatments.
And the treatments are outpatient. They come in, get a treatment, and go home, and it takes 15 minutes, right?
Absolutely. I mean...
what do patients feel during that? Like this patient, what do they feel during the treatment?
Well, this patient and 2 other patients I did at the same time, absolutely nothing. It's totally outpatient. We do it usually twice a week, sometimes on a Tuesday and maybe on a Friday.
What about if I'm available only on Monday and Thursday?
Absolutely. Monday through Friday, any day. I mean, we are doing...
So you can accommodate me. And a lot of these patients had chemotherapy before, and the chemo didn't work, and you were still able to help the patient.
And these are the patients that I'm getting now, more and more. Patients that they were in chemotherapy for a long time. The chemotherapy sometimes works for a while, and then all of a sudden the chemotherapy is not working. Everybody starts, thinking, where are we going? They come to us. We are able to put the patient in a very, very good situation on a special frame. Everything is really, really concentrated to the tumor area.
So what do patients say how do they compare radiosurgery to chemo when they tell you?
Well, the experience is completely different. Through the chemotherapy, the patients not only they go through a process of constantly checkups and problems sometimes with all other issues from, side effects and things like that. And in our case, I mean, even the patient is very surprised because after the 5 treatments, they tell me, and that's it. I say, yes, that's it. Now we're going to wait for a while. Sometimes we wait 3 weeks. Sometimes we wait a month. We repeat the PET-CT, and, we review it together. That's the other thing that we do. We do a lot of and again, I mean, I need to emphasize that the reason why the Spanish is so good, because they can actually ask every single question. We show them all the information. In fact, we gave them a folder with the test. The patients actually carry their own information on a CD. And it's very important for them to empower and to know exactly what's going on. And yes, we review everything with them.
So if a patient wants to find you, how do they find you?
Well, they can call me. And again, I'm going to say in Spanish because I know that you have a Spanish audience. So para la gente que quiere ver el doctor en español, el número mío del doctor Izón es 917-836-8105.
Ancora, what's the number again?
Es el 917-836-8105.
Okay. Can they call you today or on the weekend if they want a question answered?
Sí, and in English, by the way, it's 917-836-8105. Yes, they can call me. And in fact, the one other thing that I do is if they want to call me, just even if they have the situation already organized in another place, they can feel free to call me. I really enjoy going over the cases, and we can talk about it, and there is no obligation. They can just talk to me, and I will be very happy to go over the situation on the phone, or they can come, okay?
Okay,
Thank
great.
you, Dr.
Thank you so much. Have a good weekend.
And I see you Monday. Okay, bye-bye.
Feel free to call Dr. Eisen if you want. It's a great doctor, and we'll answer your questions. We're going to go to again, a word from our sponsor, and then we'll be back with some more news and cases. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery, New York.
News Talk Radio 710 WOR.
At Radiosurgery, New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices, 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We are back. Here we are. We're live, and you're welcome to pinch us if you want to see if we're live. I wanted to discuss a few cases that I saw this week. One was a patient I saw a year ago with acoustic neuroma. So,
Okay.
You know what it is, acoustic neuroma?
Yeah, it's basically a tumor of the hearing nerve.
Right. What is that? Do you remember that from anatomy?
Which nerve number it is?
Mm-hmm.
I want to say 8.
8. Yeah, it's number 8.
All right. Good.
When I was in medical school, we had this saying to remember the nerves. Oh. Remember that saying?
There are quite a few of those mnemonics, yeah.
Do you remember that one? Oh.
I don't think I've heard that one.
Well, I can't say it on air, so it gives you an idea of what it means. But the 8th cranial nerve comes off the brainstem, goes to the ear, and is responsible for hearing.
That's right.
And this very, 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 very lovely woman came to me last year. She's beautiful. She's talented. She's articulate. She's muscular. She rides a motorcycle. She's a motorcycle chick. Works hard. And she met with me last year when she noticed decreased hearing. And at that time, her tumor was 7 millimeters. So there's 2.54 centimeters or 25 millimeters in an inch, so it was about a third or a quarter of an inch in size.
Pretty big.
And no.
Oh, it's not.
No, it's relatively small. 7 millimeters is relatively small. I mean, big tumors are like 3.5 centimeters or 50, much bigger.
Okay.
So she had a small tumor, and I try to give patients all the choices. I don't tell them what to do. Some doctors say, you have a brain tumor, you have to get surgery today. And I think she saw a doctor who told her you had to get surgery today. Anyway, she got frightened by that because with surgery and acoustic neuromas, you often end up deaf.
Yeah.
In fact, there's nobody with a tumor more than 1 centimeter after surgery that's not deaf.
Mm-hmm.
Many of the patients have facial paralysis, which is devastating. The deafness you can hide to your friends and people that walk down the street, but facial paralysis isn't something that you can hide. It means your face is paralyzed. And about 38% of people after surgery for acoustic neuroma have infection, bleeding, spinal fluid leak, and 1% die.
Yeah.
So, and surgery's been the so-called gold standard. And she came to